Okay, so continuing on to favorite story about nursing with nursing. There's many. However, I can share one about a patient that I had. She was an older lady. And by the way, I love my older patients. They're just so amazing to work with, and I just love caring for them. However, I had this one patient. She was probably in her 80s, and she was a sweet lady, and I was taking care of her. I honestly don't remember her diagnosis, but I remember that she needed to take a new cardiac medication, a heart medication for her heart. And I gave her that medication, and unfortunately, it caused her heart to change rhythms. Hold that thought. Okay, so her heart rhythm changed. And so she was hooked up to a heart monitor, which means that there's other employees who are looking at those heart monitors and, monitoring the heart. So I got a call from telemetry, which is the department that looks at all the heart monitors. And telemetry called me and they said, hey, your patient in room 3, their heart rhythm is changing and they're having pauses. And a pause is just what it is. It's a pause in the heart. The heart can pause for a second, 2 seconds, 3 seconds. So she was having pauses and they kept increasing. So her longest pause I think got up to about 3 seconds. So I went, of course, ran into her room and I was asking her how she's doing, and she was a little bit confused. I called my charge nurse. I called a staff assist, meaning all the nurses on the floor are going to come and help you. So there's a button for that in the room. You press a button and you call a staff assist. And every nurse's phone rings and every nurse will come. And every nurse will be assigned to a task. Hey, somebody is going to be checking her vital signs, checking her glucose level to see if her glucose is low, looking at, doing compressions if her heart stops completely, and, starting CPR, things like that. So we were in the room, we were checking on her. She was confused. She said she felt dizzy. She was in her recliner chair, so we got her and kind of all assisted her to move to the bed because it's safer for her to be in the bed when, these things happen. But she was declining and she was having issues. And so we were basically having to get her heart back to the normal rhythm, meaning, there's special medications that have to be given. And a team comes from the ICU, intensive care, and they help us when we have a patient like that. So that team came and they gave her some medication. The doctor decided to move her to ICU. And so on the way to ICU, so typically if you have a patient that's moving, you have to go with them. So I'm going with her and we get into the elevator and we're moving her, and she just has no idea, what's happening or how serious it is. And so she's like, what's happening? Where are you taking me? And we're like, it's okay, honey. We're taking you to a new unit. You're going to have a new room. You're going to have a new nurse. And she's like, okay. And she's like, but I was okay in my old room. And we were like, I know. Yeah, but we're going to take better care of you. And so it was just one of those situations where, she was just such a sweet lady. She, such a pleasure to work with. And when she, even while she was declining, she was just so sweet. But we just had to stay focused on the task at hand and get her moved to a higher level of care. And she went there, and I'm a type of person that I'm very interested in what happens to my patients if they move. But, you have to move on, and that's just the nature of our jobs. So I moved on. Once the patient is not yours anymore, you're not allowed to look in their chart. So I didn't really know what happened to her. But then a few days later, she came back to our floor because she was doing better, and then she discharged. So it was really nice to see that she got better, and then she went home. And what's interesting also is that, just due to her medical history, she didn't always remember everything, and so she didn't remember me when she came back. But her daughter remembered me, and her daughter was really grateful that we got her the care she needed to so that she can get better, come back to our floor, and then discharge and go home. Now, the level that I work on is medical surgical, so it's called med surg. So it's a very popular area of nursing because it is basically where you go if you're in a hospital and you get admitted. You're stable, you're doing okay, but you need nursing care for any number of reasons. Just a vast array of different conditions that we take care of. So, but typically our patients are stable. So then when they become unstable, we have to transfer them. All right, so next question is, if you are in college, there's a lot of help. There's a lot of resources right there on your campus. And a lot of times it's just a matter of asking your counselor, but a lot of times during orientation, they will tell you what resources they have. And sometimes students may ignore it or they may not take advantage, but they are really helpful. And so when they give you those resources when you're in orientation, write them down and make sure you follow up, because you may need it and it may help. From my school in particular, while I was in nursing school, there was a particular class that helped with dosage calculation. And that's a class that you have to pass, or it's actually an exam you have to pass every semester. You have to know how to calculate dosing of medication. And so a lot of people struggle with that, and I did. And then when they offered that class, I jumped right on it. I took the class because when I took the class, it helped so much. And it was so much easier for me to do dosage calculation after I took that class. And so my favorite part of nursing is just simply helping people, helping them feel better, helping them to know that, I'm there for them and I'm there to help them and support them. Some people come in the hospital and, they're used to being independent and not needing anyone. So when they come in, they're really shy to ask for things or to bother their nurse. And I'm just there to let them know I am here for you. So if you need anything, please call. I'm going to be following all the doctor's orders and giving you, the prescribed medications and interventions that I'm supposed to give you. But you let me know if you're not comfortable with something or if you have questions. And when you really communicate with your patients, like you care, it makes such a big difference. And so I really love that part of the job. And if you're a teen and you want to be a nurse, but you're apprehensive, you're not sure, I would say to you that you can do it. Okay? It is not impossible. It is hard. It is challenging, but you can do it. Talk to nurses that you know, and I'm gonna let you know that I am definitely available if anyone wants to talk to me one-on-one. If you have any questions, it is something that is very doable. And just a caveat to that, it's not for everyone, okay? But if you feel it in your heart that you want to be a nurse, you can do it. And you just have to reach out and ask questions. And many of us, in the nursing community are willing and would be happy to help you and to answer questions that you may have and just support. So reach out, okay? Jody will let you know my number and she can get you connected. All right, take care. I hope this helped, and y'all take care and be blessed.